Now, using slow talk has no power to get you what you want, but what it did in this case was to slow this woman down so that she could approach the subject to her husband rationally and calmly. She came across to him not only as being more calm than usual, but also more serious. Another one of our women worked in a large advertising agency where concepts and ideas were important, and she felt that no one paid much attention to her ideas. Every time she had a good idea, she would hurriedly blurt it out, expecting others in the office to be excited too. Instead, they just looked at her strangely, like she had said something weird, and then basically ignored her and went about their business. What was really happening was that she was so anxious at work that she tended to blurt out her ideas very quickly, so as to avoid being the center of attention for too long. She spoke so fast, however, that it was hard for others to understand her. When this woman started using slow talk at work, she was feeling comfortable with the process, and although some situational anxiety was involved, when it came her turn to share her ideas, she switched over into using slow talk, and calmly and rationally presented her ideas to the assembled group. What happened next surprised her a great deal. She said that people's eyes lit up. Several people congratulated her, and the team took her idea and used it in its marketing campaign. They had never paid attention to her before. Now she was speaking calmly, clearly, and slowly. Her anxiety, although it was still present, was under control. The more she took her time to explain her idea, the less anxious she felt. Now she had time to think about what she was going to say. By taking the time to explain things thoroughly and clearly, her co-workers understood her better, and as a result, their perception of her became more positive. When our comprehensive cognitive behavioral therapy group members get to the place that they want to start speaking in front of the group, slow talk is an essential tool as well. The idea of public speaking scares most of us with social anxiety to death. But as you get better and less anxious, there comes a time when you're able to stand in front of a few people and give a short talk. Our initial tendency, of course, is to rush the talk and to try to get it over with as quickly as possible, so that we can sit back down and no longer be the center of attention. However, once you learn the slow talk method, you no longer will feel as rushed and anxious. You can move on into your message, making sure you're staying calm and focused, and present a talk that is clear and understandable. In public social situations like this, slow talk can be an effective and powerful tool in decreasing anxiety and increasing your feeling of being in control. You also come across more calmly, your words have more clarity, and your voice has the ring of authority. Almost everyone with social anxiety I've worked with has been able to pull a lot out of this technique. But keep in mind that it takes practice first, practicing using slow talk out loud to yourself when you're alone. When you do start to use slow talk with others, you need to start out on a small scale, talking to one safe person, such as a friend or relative, for example. We do not want to use slow talk for the first time in a gut-wrenching high-anxiety situation. We are not ready for that yet. We need to approach all the new methods, strategies, and techniques we learn slowly and then build up from there. It is important that we do things slowly, on a small scale at first, and allow ourselves to feel successful about it before we move it up to other, more intense anxiety situations. When you are practicing reading in slow talk this first week, it is good to have something to read that is peaceful and positive. That is why we have included the short statements handout. It is also important that as you read over the short statements in slow talk, that you do it out loud. Therefore, you need to have a place you can go and shut the door behind you for 30 minutes every day. Just reading this silently to yourself in slow talk will eventually help, but it will be 10 times more powerful and 10 times more effective if you read it out loud to yourself. When you hear your own voice saying something, you are using millions and millions more of your brain cells than if you read it silently. These brain neurons then have to process this information. It has to be spoken, it has to be heard, it has to travel to the ear, then to the auditory part of the brain, then to the relay station in the brain, and then it is sent to the part of the brain that understands speech. By reading your therapy handouts out loud to yourself, you will be speeding up your healing tenfold. I can't emphasize this fact enough. You don't have to read them loudly or shout, but you do need to find a place where you can read your handouts every day out loud to yourself. You will find your progress goes much, much faster by reading everything out loud to yourself, slowly and calmly. And remember, slow talk is just one technique. We will be continually adding to these methods with each and every tape. Then, each and every technique will have the effect of strengthening the others. Please take time to read the Slow Talk handout now if you wish, and practice this anti-anxiety method for yourself. Next, we are ready to move ahead with our second cognitive therapy method. This method is a strategy to control and eventually stop our automatic negative thinking. Notice my use of the word automatic. You did not choose to have this negative thinking, these anxious thoughts, this anticipatory anxiety over social situations. No one would choose to have these negative thoughts racing through their heads. Sometimes these automatic negative thoughts just take control of our mind because we have been thinking this way as a habit for many, many years. So it will take some time to change our old negative thought patterns and habits. But thankfully, we know how to do it today, and it can be done. 20 years ago, I was probably the most negative thinker on the planet. Not that I wanted to be this way, of course, but because everything I did seemed to turn out wrong. Of course, my social anxiety prevented me from having things turn out well. But instead of working to get rid of my social anxiety, I directed the blame at myself and fed and fueled my negative thinking. My thoughts were anxious, fast, and racy, but ran something like this. Nothing I ever do works out, so why should I even try? I hate having to go to this meeting. I feel like a fool. I'm just an idiot. They'll all laugh at me. I can't talk in front of other people like everyone else can. What am I going to do? I need some help, and there isn't any help available. Oh no, here comes the boss. I know he'll have something to say to me. How should I respond? I never know what to say. I always get tongue-tied and stutter. I bet I'll make a fool of myself again like I always do. I just can't handle college. Too many presentations and too many people. They all think I'm a freak anyway. I can't stand their stares. I just want to get out of here. I've made progress on my job, but look where it leads. Now they expect that I can greet people and talk in meetings like everyone else. It's just too hard for me. I just want my old job back. I'm exhausted and fatigued. How does anyone have the strength to go out to movies or to eat dinner? I don't understand it. I just want to be at home where I can rest and relax. These are all thoughts I had at one time or another during the course of my life when I was plagued with social anxiety. Many of these thoughts are true, in the sense that when I had social anxiety, there was no help available, and there was little I could do to get better because I didn't know how. I was stuck and very depressed over being stuck. One thing I needed to do was to change my thoughts and my beliefs, but I didn't know how, so I felt hopeless and helpless about ever getting better, which is another very negative automatic belief and expectation. And of course, because I expected things to be negative, they were negative for me. I brought on my own worst fears because I expected them to happen. This is called a self-fulfilling prophecy, and it has great practicality for people who have social anxiety. Think about it for a minute. If we expect and anticipate that we won't do well, that we'll get embarrassed, that we'll have an anxious time talking in class, that we can't be promoted at work because we'll fail at supervising others. If we expect those things to happen, then we've set ourselves up. We've set our minds up for failure, and these negative things likely will happen to us. So what is the answer? We need to begin changing our automatic negative thoughts. So today we will start the process of changing them. Everyone with social anxiety has these automatic negative thoughts, and it is not your fault that you have